Hi all, today we are going to discuss about ultrasound, which this is a sonoscope model, that is S20. Now it's a non-position, we have a on off button over here. Next we are going to discuss about the different types of keys and the image selection of sonoscope system. Here first, if you are pressing the exam button, we can see different types of probe selection. Now we are connected two probes to this sonoscope. This is TV probe or transvaginal probe, and this is convex probe. So these two are connected to the system now, and now I am going to select a particular probe which is of convex probe, and in that I am going to select a gynec part. So we can obtain a basic mode of the picture. Now let's see the image of a particular part. Now we can see the image. Now I am pressing the P wave, that is pulse wave. So we can see the heartbeat over there. I have pointed to the particular image and I have taken the heartbeat. If you want a audio increase or decrease, we can adjust over here so that we can hear the sound. Okay, and this is the freeze button where the image is freezed. For the further examination for the doctor, they will use the freeze button, and if they want to measure any distance, they will use this calculate. They will press the calculus button. There we can see many keys like base vascular, OB, gynec, and R uterina or left uterina, that right and left. Which part where the doctor is interested, he will select accordingly and do the examination. Now we are seeing an image over here. While examining, if the doctor wants to increase the gain, they can rotate the depth button, and if they want to zoom, they can see the image like this. This is the control key for obtaining the gain, and if there are other keys also, that is distance measurement, area measurement, and other calculus. If they also want the patient details to be entered, they can press the patient button, so they can enter the name, height or sex, date of birth, etc. of the patient and save the result. Now I am cancelling. These are the other system which is available in S20, and also there is another button called print, where we have saved the patient details and also the examines done here. So the saved data will be printed while pressing this print button, and if we are connected to the printer, the print will automatically be. We are going to introduce this body mark. While examining the image, if the doctor want a particular area to be examined, like right ovary or left ovary or the pelvis or etc., the doctor can select the particular area which he got interested. So now I am selecting the ovary. If it is selected, according to the examination, he or she can examine the area which is interested. So it will be very helpful for the doctor to get a good image while examining. There is another more key, that is M tuning. While pressing this single button, we can obtain the image with good clarity. We need not want to give again a gain or depth to the ultrasound. While pressing this single key, the optimum image will be obtained. We have already discussed about the B mode and M mode. Likewise, we have also CFM, that is color flow mode, and also the continuous wave mode, that is also present in this system. Other key which is we are going to introduce is body mark. While examining the image, if the doctor want a particular area to be examined, like right ovary or left ovary or the pelvis or etc., the doctor can select the particular area which he got interested. So now I am selecting the ovary. If it is selected, according to the examination, he or she can examine the area which is interested. So it will be very helpful for the doctor to get a good image while examining. There is another more key, that is M tuning. While pressing this single button, we can obtain the image with good clarity. We need not want to give again a gain or depth to the ultrasound. While pressing this single key, the optimum image will be obtained. There are some other keys also displayed here, that is frequency, chroma, like that. Where if the patient is very fat or obese, we are going to reduce the frequency. So I can select the frequency, then adjust the this image which we are seeing is the basic image or B mode image. There are some other keys like M mode or 4B, like that. If we are pressing the 2B mode, we can see the two images, and then I am going to unselect, and if we are pressing 4B, we can get the different types of images also. There is another more key, that is M mode. There we can see one static image and one motion image corresponding to the single page. So now let's discuss about the other key, which is if you are making an image like this, if we want to obtain the report, we can press the report button so that the report will be obtained accordingly. So we can save, or we can see the previous or next images, like we can comment, like that options is also available. And also there is another button called file. So in that there are many other reports of the previous patient. If they want to get a examine of the particular patient, they can directly go to the file and just press the button to obtain the examines. Now let's suppose we are doing the examines. First we have to find out the heart rate or heart rhythm. So I have selected OB gynec, and this is the B mode image which we have seen. Then I am going to find the pulse wave. So I am pressing the PW, and also then I am marking the area where I should get where I am interested. Then press the update button. If you want to increase the volume, you can adjust here. So we have find the heartbeat of the patient. Next we have to save. So what comes is here we can find are you sure, and go to the preset button. So what we do is press Y button. So we will get this page, and here what we are going to do is create new exam. That we will place the cursor, then press the set button. Then if suppose I am giving a name like F. This is the name I have given. Then you can press the OK button. Give the cursor to the OK button, then press the set button. Okay. Then press the exam button. Yes, here you can see the REFQ which we have saved just now. So if we press the same button, we can get what the image what we have saved, or exams what we have created. Next, if you want to see the color flow of the image, we can press the CFM button. Here there are many options like 2B, 4B and zoom, etc. Suppose if you are pressing L by R, we can get a left or right button. Then if we are pressing 2B, you can get one static image and one motion image. And if we are pressing this button, we can turn which image which we are interested in. And likewise we can zoom in and we can change the frequency, we can change the WF, then PRF, etc. can be changed according to the doctor. And so according to the image, the measurement will be denoted over here also. Likewise, there are other modes also, that is M mode. Here we can change the clarity, like motion image will be obtained. If you want to zoom in, we can zoom that also by doing this, changing this cursor. If we press the CFM, we will get the area where which we are interested. We can change the place also. Okay. So according to the flow or measurement which we have kept here, it will denote the measurements over here. We can change frequencies, everything we can change. So if I am taking DPI measurement, we can change the frequencies and PRF, density value, everything we can change. And also we can place it in 4B. Now we are going to study about this calculus button. That is to give, as usual, we can calculate the values and see the report. Press that. First press the freeze button, then press the calculus button. Okay. Then we can see many options like general, baby plus, CES, like so if I am putting OB-GYNIC measurements, we can measure AFL plus, AC plus, FL, fetal length, everything. So I am measuring AC, suppose. So I am going to measure AC. And if you want to increase the diameter and also the width, you can change this cursor and do the measurements, then set. And also if I want to measure AFL, then that also can be measured. So like randomly I am putting the measurement. You can measure according to the baby and mothers, like according to the patients you can measure. Then you can press the report button. Now if you are and also there is another button like area, where we can measure the area where which we is interested in. If it is a OB-GYNIC area, some doctors will examine right ovary or the baby fetus or their head or anything which they are interested in. So they will mark a point and make a set button, and which area is needed, they will mark it and put another set button, so that area will be measured. So here we can see how much area, how much millimeter square, everything will be given. Let's see how we are going to connect the probe. So I'm going to unlock this, so it will become loose. Here there is a key where it is pointed upwards. So we'll keep this to the hole in correctly, then lock it. It's fixed. This is how we connect the probe. This is the basic outline about the Sonoscape S20 ultrasound machine. Hope you all understood. Thank you.